Welcome to another exciting episode of Hajj and Hadi. We are here live in Medina Munawwara, and I'm with the famous, the great Dr. Rehan Malik. Yay! So a little intro, just so you guys know who he is. So both our wives are twin sisters, but I knew Dr. Rehan, or Ray as I like to call it, I knew Ray way before he even got married. I was friends with him even before, like a good like 20 years ago, or 20 plus years ago. And it just so happened that it worked out that he ended up with one sister, I ended up with the other, and I was like, wow, this is great. This year worked out even better. I don't know how it happened. We were all in like NYIT, like undergrad, and it just kind of worked itself out. And then he had gone to med school in the Caribbean. I had gone to NICOM in New York in Old Westbury, and it's just funny how things worked out. But I was so glad when he did marry her because I was like, oh, this is great. This is just it's a wonderful thing. And he doesn't live too far away. He's in New Jersey. And our children, they are relatively similar ages, and they're very close, and we have a great relationship. And just a little background, just so you know, he's like an expert in all this stuff. He's very like bashful guy. He doesn't like, but I have to say it anyway. Look, he's like a board certified psychiatrist, and he's board certified in addiction. He's like the program director for Trinitas. He's got his own private practice.
He's like kind of smart.
Oh, he's very smart. Yeah, he's very smart. He's very smart. He makes good decisions. You go to him for advice. So, he's very, very well-rounded, very humble, really good guy. And I think you guys are in for a really nice podcast too.
Yeah, no, alhamdulillah. Thank you, first of all, for having me on this podcast. I've definitely tuned into a few of the other ones you've had.
Oh, you watch us? Great.
Yeah, for sure. I'm subscribed. And,
thank you. All right. I was like, good.
I'm subscribed, and it's a lot of them have been very informative as well. And I know my Mo over here, Dr. Hadi, has we've discussed having this. And no better place to be in, and blessed and to be in the Prophet city here in Medina, right behind us. So alhamdulillah, it's a blessing to be here and an honor to be here to even just have a discussion with Dr. Hadi. And
well, I mean, the main thing is, look, mental illness just keeps getting bigger and bigger.
Right.
From when I was a child to now that we're like middle aged, I can't believe we're saying that we're in our 40s. I keep seeing it over and over again. And a lot of times people come in with certain pains or certain illnesses, but a lot of the time the comorbidity is they have some depression, they have some anxiety, maybe a little bipolar, some people are schizophrenic, I don't know, whatever it is. And I'm always consulting him because it's nice to have him on speed dial. It's just very convenient for me. Like, what do you do? This and that. But I'm seeing it's becoming so prevalent. I mean, Haz, I don't think there is anyone, especially in America, I don't think there's anyone who hasn't been touched, whether it's a friend or a family member or something with some kind of mental illness, or they've seen them be hospitalized, or they've seen them in treatment, or they need treatment, or they go to like a psychologist just to talk it out, or they go to a psychiatrist, or they go to some mental health specialist or counselor or some form. And drug addiction is huge. It is huge in America, and a lot of psychiatrists are working with a lot of drug addiction, and there's a lot of treatments out there for it, and a lot of it has to do with mental illness, most of the time.
Yeah, exactly. I mean, I think Dr. Hadi said it best, but it is a real need in the community as well. And like you said, the families have also experienced it, and I've had a lot of encounters where I've been
I'm sure
referred.
You have great stories.
I've been getting a lot of referrals. From I think, like you said, we were growing up to now. There has been a big change, and I think a lot more is starting to accept that mental illness is real. It is a real need for psychiatrists and for other providers and treatments. I know Dr. Hadi treats a lot of patients as well that have mental illness.
I don't have a choice. Not that I want to, but I don't have a choice because it's everywhere. Now, Ray, I wanted to ask you, what do you say to the people who, especially like traditional people or old school people, older generation, they don't really understand, depression or anxiety. They don't understand these things, and they just tell the young person, or they tell the person, listen, you just got to figure it out, or that's not real. You're okay. You pull yourself up by the bootstraps. Just get out there, grind through it. You know, this, that. I mean, what do you say to that?
Yeah, pray through it.
Or something. You know, do something.
No, I mean, that's a great question. That's probably really what we deal with all the time. I mean, there's still, unfortunately, a big stigma and across all cultures. I mean, not just, you know, in our culture, but, you know, we see that pretty commonly. And really, you know, even in the Quran and the Hadith, right? It's written as far as depression and anxiety and other mental illness conditions, as far as different prayers and du'as. So that really tells us that mental illness, it is an illness.
It's a real thing.
It is something. So even you know, commonly, like you said, somebody says, oh, just pull yourself up or something. And I think that really summarizes probably how people feel about mental illness, that they feel that it's probably a choice and that it's not really a disease or an illness, right? Even with addiction, we commonly see, you know,
like, just don't do it.
They say, like, just don't do it, right? But it's
not that simple.
It's not that simple. It is an illness, and you know, a lot of times, or the times when they're you know, when they're not feeling well, they're decompensated. It's not their choice. It's really part of the illness.
So we would also go every year. We would come to Saudi Arabia and do the Hajj clinic. All right? And that's where I really got to appreciate psychiatry. I'm going to tell you guys. Because we would come and we'd treat like thousands of people every year. And a lot of times, it was just like anxiety or depression. Like, I don't know, he'll tell you the story best. Like, there was one guy, one pilgrim who came, and he said something funny. He said something like, oh, I sneezed 3 times, and the last time I sneezed 3 times in a row, I ended up in the hospital. I almost died. I'm going to die now. I can't make the Hajj. I can't do that. I mean, what was that? Just tell us a little bit.
Oh, man, it was, you're right. It was definitely, you know, good times. My first response was, I'm a psychiatrist, and this is, you know, I treat anxiety. And she was like, oh, thank God, you know, and, you know, alhamdulillah, he felt much more comfortable, and still leading up to, you know, because Hajj and any of these days, it is something that, you know, leading up to at least, you know, to the Hajj days in Arafat.
Yeah, it's a spiritual experience. Some people waited their whole life to do it. I get it. Mm-hmm.
Yeah, so he really was struggling from then till we got there. And then, you know, we really had to give him a lot of support. I mean, he was on medication as well, so I made sure I just, you know, went through and reviewed it with him. And then I still remember in Arafat, when he came off the bus, he was very excited, came over. I remember he gave both of us a hug, and he felt that, you know, we helped him through it.
That's right.
You know, and there was many cases like that. You know, I remember, you know, one time in Mina, I was woken up in the middle of the night, and it wasn't even from our group. It was from another group, and they said somebody is suffering from chest pain. And when I went there, was a young lady.
Panic attack.
It was a young lady, and it was a panic attack. And really, when I asked her, you know, what was her like thinking, or what was triggering this, she said, tomorrow is Arafat. Tomorrow is a big day, and she was very stressed that she was going to, you know, not be able to, you know, complete
her rites and rituals.
So it was, you know, we see it, you know, when we are here at Hajj times. We see it, you know, even here, you know, in any cultures, right? In any country, not just somewhere like in the U.S. where we are.
Absolutely.
You know.
Yeah. No, it's universal. So it's interesting you said panic attack. So this happens a lot too. We get patients and it's a panic attack, but it mimics kind of like they have chest pain, they have sweating, they have all this stuff. They think they're having a heart attack or a stroke or something or whatever it is. They rush to the ER, they get a huge workup, everything comes back negative, and they're like, look, it's just, you're just having panic or anxiety. And the person is just kind of like let down and like, what do you mean I'm having panic or anxiety? Like I thought I was gonna die and this and that or whatever. So, I mean, what do you do for those kind of people?
Yeah, I mean, you know, the thing is, it's you still have to exclude the medical cause, right?
Got it.
So
We've excluded everything. Yeah.
So first thing is going from there. So once you have, you know, you have to see what the triggers are, what the underlying causes are. A lot of times it could just be, you know, it could be something that they're thinking about, something that you know is stressing them. You know, there's a big component as far as genetic as well, and you know, it could be other factors involved, but. You know, it's common, you know, and one of what, as far as panic attacks, I mean, if, you know, since we're talking about it, the toughest thing with panic attack really is, you know, once someone experiences a panic attack, they really are afraid of experiencing another panic attack.
Right.
So it almost brings itself. It's like a self-inducing, right?
It's like a cycle.
Yeah, sure. Like, you know, if somebody has a panic attack one time, and they begin to experience any symptoms, right? If they
Right.
start to have, their heart's racing again or sweats or
Right.
anything, they're afraid of having another panic attack.
Right.
And sometimes that fear can bring about
The
another
panic attack.
Yes.
Great.
It's very common. We see it all the time.
All right, that's interesting. Now, okay, how do you know, like, look, somebody shows up to the ER, because you also do all these ER consults, I know, and you even do these, amazing thing about psychiatry, I'm actually jealous, is they could do everything from home if they really want to. They get, now thanks to like COVID, they do telehealth, they do all this great stuff. They even can admit people from the computer in some psych ER in like Michigan or something. It's great. Everything's there on the computer. They make a quick call and everything's done. It's a wonderful field now. They made it really like convenient. One-stop shop. They made it very convenient. Now, how do you know, like, okay, this is like outpatient, like this is something we can deal with on the outside, versus like, oh no, this is kind of serious. He's got to be admitted or she's got to be admitted, and they need, like, the mind needs time to rest, or they need like, everything got to check themselves in, or you got to get them committed or whatever. Like how does that work? And another thing everyone wants to know too is, okay, a lot of people, they're like, I don't want to be admitted or whatever. Does it take 2 psychiatrists to say, no, this guy is a harm to someone himself, whatever, we're going to commit you? And then what's the process? Like, then they got to go before a judge. I remember this from my rotation.
Yeah, you're kind of answering it already.
I don't remember exactly. Like
Yeah,
it was like a week, and then you got to go before a judge, and this and that. Just tell us that. Clear that up, because I forgot. Yeah.
Sure. So, I mean, it's a great question. You know why? Because, because of the misconception or misunderstanding of the process, I think a lot of people are really probably afraid to seek out treatment, right? Because they're not sure of how this works. So this is, a great question to kind of clarify. And really, when someone comes in, be it in the ER, in your office or clinic, you're assessing for what's going on. And then the main thing is really to see if they're safe, right? If there's a safety concern, and the only way to really see that is if they're functioning or not, right? I mean, sometimes they don't necessarily have to be, we kind of sometimes say, oh, are they a danger to themselves, or they're suicidal or homicidal? You hear that a lot. But even if they're not functioning, right? I mean, commonly we see someone who, because of their mental illness, they're just not caring for themselves. They're not eating, they're not sleeping, they're not drinking, they now need medical treatment. So those times, it's more beneficial for them to be in a hospital, because we can get them better quicker. Right.
You guys, I remember that GAF score or whatever, global assessment or whatever. So is there like a number, like, okay, if they're under 60, they got to get admitted, or 50 or something? I forget what it was.
Yeah. So you're dating yourself now.
Yeah.
That's DSM-4 days, right?
Okay, yeah, that's what I remember.
We used to have those with the 5 axis.
Yes.
Axis 1 and Axis 5 was a global assessment scale. So yes. And we used to be somewhere like 30 or below or something like that. But we don't really. It was very subjective.
Okay,
right?
cool.
So we don't use those as much anymore. But really, it comes down to like we said, right? If they benefit from it, if we feel they are a danger to themselves or even others, right? They do meet the criteria for hospitalization.
Right.
We prefer that they would sign voluntary. Right.
Let's say they don't want to sign.
And if they don't want to sign, then yes, there's variations in how the law allows psychiatrists to practice, and it's really based on state by state. Like New York has a different law as far as governing commitment process versus New Jersey, for example, or California, right? But to kind of simplify it, you need one psychiatrist to at least start the process of commitment. That's usually the screening psychiatrist, as they say, meaning somebody in the emergency room that you'll see. Once that happens, then they go into an inpatient unit in the hospital. Right. So now the treating psychiatrist will now be the one who will certify that this person needs to be. So it takes 2, yes. Okay.
Now once they're in, let's say a couple of days go by, they're like, I want to get out. I'm fine. I want to get out. But you're like, no, you're not fine yet. What is it, like a week, and they have to go before a judge? I forget what it was.
Yeah. So in as per the states, right? It's everyone's right. They all have to have a hearing once they're screened, right? Within 21 days is what New Jersey says. New York has a little bit different. So again, everyone has a little difference. But yes, so if the patient feels it, they can actually contact their lawyer, their patient advocate. So It's really meant to protect the patient. It's not, the way the law is written. It's not, in any way meant to lock them up.
Right.
The real reason why this is all written in the way it is because psychiatric inpatient units are locked facilities, right? So now if you're holding somebody in a locked unit, you want to, you have to make sure that their rights are protected.
Sure.
So, they're able to contact their lawyers and whoever and have a hearing on the unit. Like in New Jersey, for example.
So, I mean, like the mind, just like, any other muscle or any other thing, like the mind, the brain, it just takes longer to recover. Like sometimes, let's say they're in psychosis, right? They're rambling, they're like not with it. Like yesterday they were perfectly fine, they were functional, and today now they're like laying in the road like half naked or something. I don't know, whatever it is, right? Or they're like trying to jump off a cliff or throw people off a cliff, whatever it may be, right? Which I'm sure you've seen. So, like you can come back from that, right? It's not like this is it. You're going to be crazy for I shouldn't say crazy, but you're going to be mentally ill for the rest of your life. You're going to be in psychotic for the rest of your life. You're like in psychosis for the rest of your life. You're going to be like in a manic episode for the rest of your life. Like you come back to normal baseline, right? I mean,
so it's a good question in a way because baseline, it really depends on what the diagnosis is, right? I mean, psychosis.
Yeah, tell us.
Just to kind of keep it in simple terms, right? Psychosis could be many different things, right? One could be somebody which we usually associate, right? We'll say somebody is hallucinating, like they're seeing things or hearing things, right? But psychosis could also be, someone has a delusion, like they're paranoid that someone's after them, someone's against them. They might not be hearing voices or anything. Or it could even be that they're disorganized, meaning their thoughts are just not linear, right? They're all over the place, or they're just not making sense. They could have bizarre behavior, bizarre thoughts, right? So now there could be many causes of that, right? I mean, it could be the most common, to be honest, is depression because it's just that many more incidents of depression, right?
Right.
As opposed to schizophrenia, which is much less common than depression, right? Now, if it's due to depression or a mood disorder, right, or bipolar, something like that, or if it's due to drugs, the chance of them returning to baseline is much higher, right? They recover, they do well as long as
perfectly normal
you treat
life.
the underlying cause. Yes, I mean we see very commonly even psychosis induced from medications, right? Sometimes steroids or
whatever.
I see Keppra and all these other medications. So same thing, right? I mean once you kind of either remove the offending agent or treat the thing, it's
But Ray, this is what's always interesting to me, right? So like the way they taught us, it's like, okay, if I'm depressed, I have less neurotransmitters or whatever. I have less serotonin, less norepinephrine, blah, 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 less dopamine, all this stuff. So if I take the drug and those levels go up, I should be cured, right? But I'm not. Like a lot of people still have some depression, they're dealing with it. Maybe it's a little bit better or it's somewhat better. Like they do need the medication, but at the same time, they're missing other things. So it's not that simple.
No, not at all. I mean, this is probably a conversation I have very frequently with patients, families, right? It's really a multifactorial disease, right? It's not just an imbalance, right? I mean, we sometimes like to simplify things and say, oh, it's an imbalance, a neurochemical imbalance. It is, sure, but a lot of times the imbalance is caused by a lot of different things, right? I mean, sometimes I like to use analogies, right? So if somebody has diabetes or high blood pressure and you put them on a medication, if they're not taking care of the other factors that are affecting it, such as, they're still eating, their diet is poor, they're not exercising, they're not doing things.
They smoke, they drink, they do all these things, sure.
The risk factors are still there. So similarly with depression as well, or any of these conditions, anxiety or anything, right? The medications help to control the symptoms, or more importantly, to prevent, severe episodes, right? But you really need to manage all aspects of your life, and
what? What do you mean? What do you see? Basically, is what I'm saying. Like, what are Americans really suffering from? That's what I want to know.
Yeah, so I mean, a lot of it goes back to just even taking care of yourself, right? I mean, if you're not sleeping right, you're not taking care of you're eating well, right? You're not exercising. You're not, even socially, right? You're not interacting with family. Like you don't really need that support system in place. If you don't have all those things set in place, you're probably more prone to having different conditions like this, right? Or different symptoms.
Well, so I read this study. I mean, I think we even did like a reel on this, whatever. We found like all these studies, they showed like the number one factor that really showed longevity and like quality of life was like strong interpersonal relationships. It wasn't not smoking, it wasn't not drinking, it wasn't like exercise, it wasn't diet, it's like if you want to live a long, healthy life, so you have to have very good social, strong interpersonal relationships.
Yeah, it's really important, in psychiatry, and again, I'm probably going off a lot into how we practice.
Like our society, has it become like we've just lost those relationships?
Yeah.
Like the family is broken down, friends are broken down, like there's no more community, there's no more, like, is this what a human being needs is what I'm asking.
Yeah, and the approach that psychiatrists usually has, right? And you probably remember this from medical school days too, is the biopsychosocial model, right?
Yes.
Like we usually approach somebody. So, I teach residents all the time, and when the residents after they when they're presenting a patient to me, at the end when they have to give the assessment, they usually have to break it down into that what's the biological factors, what's even the treatment wise, right? So we kind of cover that when you said neurotransmitters or all this imbalance. But the psychological and the psychosocial parts of it is a big component, right? So even for the treatment. So yes, it's if you don't have a strong system, a support system in place, especially to somebody who's prone to having these, it's very difficult for them to manage.
Now, okay, look, what about like, okay, certain people, and I see it more and more, like I see these mood disorders. It's like undiagnosed mental pathology, okay? They clearly like bipolar, or they're clearly like, I don't know, some kind of personality disorder or something. It's very clear to me. I can see it, and I'm not even a psychiatrist, I can see it. Now, like these people, they can live a full, healthy life, right?
Yes. Yeah.
So like they just gotta take their meds.
That's our goal, right? Our goal is to make sure that they're able to function and have a good, healthy life. And
do a lot of people like follow up? They take their meds. Like, do you think it's like this, or it just falls off? Or like,
unfortunately, like it's still a big stigma, and very commonly, patients or people feel that they don't need medication anymore, or a lot of times it's still a denial of the mental illness, or saying like, oh, I didn't have depression. It was. Or I don't have anxiety or bipolar or something like that.
How do you cure like depression, or how do you cure these things? Is there ever a cure, or you just deal with it, just manage it?
Yeah, I mean, cure. It's it's manageable, right? It is something that's very treatable, and manageable, right? It really it goes back to seeing, what's the triggers, what's the other condition that can be towards it, right? That's why it really. A lot of the patients, we don't just have them going into medication management only. A lot of times they need therapy as well, right? And the therapy is really geared towards exactly what you're saying, right? Is really to identify some of these triggers,
avoid them,
and see, also a big part of it is once you identify the triggers, to see what you're doing in response to these triggers. Sometimes you don't realize what you're doing is really a more negative, right? It's more like a maladaptive and kind of negatively reinforcing it, right?
Got it.
So you don't realize that it's affecting you.
No, I mean, like I see like depression more and more every day, right? Anxiety too, I see, but anxiety, I feel like the patients or like our friends, family, whoever it is, it comes and goes, right? But the depression, that's like there. And it's just, it doesn't seem to go away or whatever. Like, how can we improve the depression other than just taking the medication?
Yeah, so you really got to work on those other parts of it, right? I mean, sometimes they don't have a strong social network. They don't have a strong support system, be it family, be it friends.
What about like a faith, religious faith or something?
You just took the words right out of my mouth. So I was just about to say, a lot of part of it is also having that faith, right? That spiritual as well, and from our faith, right? I mean, there's a lot of kind of prescriptions, if you want to say,
Sure.
of how to treat depression and
Sure.
anxiety. And
Yeah.
you know, there's du'as as well,
Right.
but a lot of it is also
There's prayers. Du'as, some people are not, you know. they
yeah,
understand.
so
There's
du'as and prayers and
There's-
different ways to help with yourself as far as that. But it also is really, you know, focused on building those support systems as well, the structures, you know, and taking care of yourself, right? I mean,
I feel like in Islam, at least we can talk from an Islamic point of view, it's very God-centric. So it's like the more you remember God, the more you're attached to God, the more you're like following God's commands, the more you whatever, you know, these things won't affect you as much. Now, I feel like it's that for the Christian faith, Jewish faith, probably for everyone else's as well or whatever. But do you see that like clinically?
Sure, all the time,
okay.
all the time. You know,
All right.
an interesting thing that I see a lot is the cultural effects of how do I say this? Of how someone interprets their symptoms, right? So, for
Right.
example, if someone has depression or even psychosis, right? In different cultures, they present differently. So, for example, you know, in the Asian culture or even the African culture, they might have a more pleasant or kind experience as far as their psychosis goes.
Okay.
And in the Western culture, a lot of times it might be more of a more violent or even aggressive presentation of their psychosis,
Okay.
right? So that kind of shows us the effects of how, you know, culture can have on even their symptoms, right? And Islamically, you know, if you read, there's a great book that you know I have as well. It's called Prophetic Medicine, right?
Right.
And it describes a lot of
Tibbun
kind of from the
Nawawi.
Hadith and
Right.
even the Quran and a lot of different treatments for different illnesses, right? And it does talk about depression and anxiety as well. And it really, you know, it has different prayers, but also going back to the same thing, I know I'm keep stating it, it really says to focus on your whole body and your spirit, right? To
Right.
make sure you're taking care of it. And, you know, a lot of times I feel it's neglected from there.
Okay.
Right.
So switching gears a little bit. So I want to talk a little bit about drug addiction. Now, this is the crazy thing. So I'll never forget this. I was like a third-year medical student, and I did my psych rotation at St. Barnabas in the South Bronx. Okay, just a great place. But yeah, but you do learn a lot. Okay, I remember it was my first day, and I remember the doctor who was my attending. His name was Dr. Schiffhauer or whatever. This guy was great. Okay, he was like. I was very intelligent, but this guy, he was really funny because I was just like new. I was like there, and he said, "All right, meet me in the ER." So me and like two other girls. I remember we were a third year medicine. It was our first day on psychiatry. We rushed down to the ER, psych ER, and you know they have like these little rooms and they have the curtains and they have these lights. Okay, these lights up on top or whatever. You know, Hassan? They had like these crazy lights. And he's like, okay, have any of you guys ever done like a history and physical on a psych patient or whatever? I was like, not really or whatever. He's like, all right, well, you got to learn today, all right? So he goes, he's like, you're a big, strong boy, no problem. Okay, go in there and get a history and physical. So I'm like, all right. You know, I go in, I have like a notepad, I have like all this stuff. And I open the curtain, and bro, this guy was huge. He was jacked. Like he was like 6'6", probably like 250 pounds of muscle, like he was huge. He's got no shirt on. He's got like little shorts. He's got tats everywhere, bald, you know, like a big guy. He was on so many different drugs. He's literally swinging from the lights. Like he was swinging. I was like, he wants me to get a history of physical. I just like closed the thing, went back. I was like, I can't do this. He's like, all right, calm down. You know, he's like, and I remember I was there for 6 weeks. This is how I knew I couldn't do psych. You know, well, at least, I mean, general psychiatry, I shouldn't say that because general psychiatry, it's very calm, it's relaxed, it's a great feel, whatever. But that inpatient psychiatry was a little bit rough for me. And I'll never forget, they had this room, okay? They had this room and, you know, they would put like the patient in the room or whatever. And he like went in and I was like right behind him. And, and they like, he went to go take an interview of the patient who's like, obviously, I don't know whether he was like manic, he was psychotic, whatever he was. I couldn't even tell. I don't know, whatever. And they gave him like some food. They gave him like a sandwich or something, right? So what he does is he takes the sandwich and chucks it at the attending. He just chucks it like a fastball. This guy he had like some reflexes. He catches the sandwich. He looks at it. He's like, I don't like bologna or something or salami or something. He throws it on the ground. I was like, this place is nuts. I was like, oh my. But like how do you deal with those kind of people? Like, what do you just tranquilize them? Like, I don't know what to do. I don't even know the first thing.
You know, first of all,
and they're all like on drugs, like all kind. Like when they do the drug report, man, they're positive for everything: cocaine, MDMA, heroin, speedballs. I don't know, whatever. Benzos, opiate, like everything you would think of. Positive. I've never seen anything like that. Yeah, so I'm sure you've seen that stuff.
Sure, yeah. I mean, first of all, you know, you got to give some credit to that attending.
Yeah,
right?
yeah, he was great. He was great.
And
shout out to Dr. Schiffauer.
Yeah, we say that a lot too, and you know, I work in the ER as well a lot in the psychiatric emergency room, right? And you know, after seeing cases like this, a lot of times, we just have just some of the staff or other doctors were sitting there, we're like, you know, you really gotta kind of enjoy it, right? You gotta take it like that. Otherwise, you know, you see cases like that. Yes,
you freak out.
It really affects you, and you know, especially with substance use, right? I mean, because a lot of times there's a different stigma attached to that, right? And I think if anything, it shows you that mental illness is real, right? I mean, because when you see somebody have that kind of experience after using a whatever drug they used, right? Be it, like you said, manic or psychotic or depressed or anything like that, it shows you that there really is some sort of chemical imbalance or some sort of influence of these symptoms, right? So it kind of shows you that it's not like the stigma that some people have on mental illness.
Yeah, look, it also reminds me of this other time, I'll never forget, those 6 weeks were crazy, I remember, and we were on the floor. Now we're on the inpatient unit or whatever, and so you have to go around, at least, I don't know whether it was like 3 times a week or 4 times, you had to get like a note on them, whatever. We'd do all the notes, we were students, we would make us do everything. And I didn't mind, I went to like every single person, whatever, and sometimes I couldn't help but think like some of these people were like possessed. Like really, like it was like such a flat affect. Like I don't know, they're talking like they see Jesus or they see that, like the way they talk. I'm like, like I don't know. Like I get it. Look, it's probably very rare, very, very, very rare. I'm sure majority of the time it's easily explained. Whatever it is. But I always wondered if like that one guy or that one gal, she was actually like possessed by like a demon or something or whatever. It's just something I always like think about once in a while.
Yeah, I mean,
have you
ever
seen anything like that?
I still think like that.
You do?
Right? I mean,
I'm not crazy.
We're Muslim, alhamdulillah, right? Yeah. And we know that jinns are real, right? I mean, it's written in the Quran. There's different examples of it, of creations of, Allah subhanahu wa ta'ala. So it's not like we're not believers, right, of jinn and all of this as well, right? Now the question really comes into jinn possession, right? And I mean, I've had discussions with sheikhs and different imams as well. I have a private practice as well, and I get referrals from imams and sheikhs in our community, all the time. And a lot of times it's after the imam or sheikh has already ruled out the jinn possession, right? And they're usually like, hey, you need to go see a psychiatrist.
Yeah, but don't you think that's like backwards, right? Like shouldn't they go to the psychiatrist first? It's like if we can't figure it out, then maybe we call in the sheikh or the imam.
I'm glad you said that. I'm glad you said that. You know why? Because I think if I want to have any one take-home point today, and after even discussing with different imams and everyone, is really that, right? I mean, they really, I think even was written for as the proper way to really go about it is like you should really rule out medical and psychiatric causes first, and then go towards there. I mean, I've even heard, and I don't know, these aren't really official stats, but like I've discussed with imams that deal with jinn possession and ruqyas and treatments of that nature, and they've told me that they've probably as low as 1% of the cases they've seen it might be something. It may be something, right? 99 of 100. So it's just we really should be first starting with seeking medical and psychiatric.
Yeah, but Ray, I realize it's not just us. Like I have all these patients who are Catholic or whatever, right? And when things like that, the first thing they think too is that they're possessed. Or like I have a huge like Hispanic patient population. First thing they're possessed by some demon or something, and I'm like, I don't really think so. Yeah,
I think it goes back to everyone wants to be in denial and not think that they have a mental illness. They want to think that it's probably, you know, a possession
Supernatural.
or evil eye.
Correct.
Somebody did this, and you know, I just need to pray and do that as well.
Someone's
you know?
performed black magic.
And you know,
on
it's you know, it's sad. I've seen cases, you know, and just one comes to mind, right? And this was a young girl. She was like 18 or 19 years old, and she was, you know, a Catholic girl, and she actually went away for school. And she actually was got a scholarship in a Catholic school, right? And she by the time she came to us, it was like about a year later. But after we had gathered all the history, you know, she actually just had a psychotic break in the school. And what happened was, because it was a religious school, they had started religious treatment, like a spiritual treatment. So what really happened was, and the mom was telling me as well, they actually had somebody fly from another state and like treat her. And really, the mom was saying she was reprogrammed, like the person was reprogramming her. And it seemed like ruqya, like how Islamically would be ruqya, so the way she was describing it, right? And you know, the poor girl, really what happened, it was untreated psychosis. And just like, you know, any other illness, if you leave it untreated, it gets really severe. And she became catatonic. When she came to us, she was non-responsive. Right. She was like, I remember,
non-verbal, not moving.
She was on the medical floor. So I saw her as a consultant, and she would not respond to even painful stimuli. Like I was doing sternal rubs. We were like, you know, doing needles and everything. Like just no response to painful, to stimuli, to verbal. The mom, everyone was talking to her, shaking her, right? And I diagnosed her with catatonia right away, because I've seen cases of catatonia. And you know, the family was in denial, and the poor girl had not eaten in days. She had not had any nutrition, any sleep, and other effects. And the family was very preoccupied and focused on that nutrition was the cause of this, right? And it took us a very long time to really, you know, convince the parents that this was catatonia. Right?
So what did you do for that? You just give her a medication, or?
You know, medications work very well. Actually, there's actually it's called Ativan Challenge, right? So the way we actually were able to diagnose her, she needed to go for a scan, right? They were like, we should get a head CT and an MRI just for, you know, comprehensive assessment. And you know, because she was still moving a little bit, so we gave her some Ativan just to it's a sedative. It's actually a benzodiazepine for, you know, for anyone that doesn't know. But it's actually almost diagnostic for catatonia. She, after getting it, she actually, almost like a miracle, she sat up and she started talking for a few minutes. Unfortunately, it doesn't hold that long, and she relapsed back into catatonia. And I actually treated her with ECT.
Okay.
Yeah, which is...
What's ECT?
ECT is actually electroconvulsive therapy, but
what they show in the movies?
Yeah, what they show in the movies. But you know, what it really is you're inducing a seizure, right? And there's many.
So they're just basically shocking the brain.
Yeah. So you know, it's not like how they show in the movies. I mean, I've been doing this now for a few years, and you know, I've become a believer myself. And you know, it's under anesthesia. It's very controlled. You know, patients even given a paralytic. So. You know, you monitor just a motor seizure in a lower limb, as well as just the EEG leads that are on there. It's very controlled.
What's the idea? Just reprogramming your brain?
So yes, there's actually a few different kind of hypotheses. Unfortunately, it's still not fully understood. But yes, some believe that it might be in a way reprogramming the cells. It might be misfiring, right? Because it does work for different conditions. It works for depression, which you said was, you know, earlier was a deficiency, right? Yeah. And it could be working in psychosis, which could be an excess, right, of dopamine. So it really works in different conditions, for different conditions. So some believe it's probably correcting the misfiring of neurons, or you know, some believe that it's actually the stopping of the seizure. So when you induce a seizure, the body has a response because it doesn't want to seize, right? Right. So it releases all these, GABA and other neurotransmitters as well, right? And that has some therapeutic effect as well.
Got it.
Yeah.
So now my question is, so like now in most of the states, my next question, because we're still on the topic of drugs. Okay. So in most of the states, like THC or marijuana is legal now, right? First it was just medicinal, now it's become more recreational. You just walk into a shop, you show like your driver's license, you could buy, and it's insane. Like THC is insane. Like you got this strain that helps for sleep, and this strain that keeps you less anxious, and this strain that gives you energy, and blah blah blah. I mean, I don't even know. You could write articles on this stuff. So do you find like marijuana to be very helpful in a lot of mental illness?
So, in mental illness specifically, there's still a lot of controversy, right? There's some states actually that still say, regulated in that if you have mental illness, you're not able to obtain it. Well, medicinally, right? It excludes you from getting it.
Got it.
But, there are a lot of benefits for marijuana as well, right? I mean, for even in conditions like anxiety or epilepsy or pain and other conditions as well that it is approved for, right? Now, the question always comes as far as, if it can cause psychosis, right? A lot of times we see that very commonly in like a prodromal, like schizophrenic or somebody who's using marijuana, right? I really haven't seen that. I've seen more probably before, they were using on the street. You don't know what was on there, right? If it was
this is
laced
like pure
with something,
stuff now,
it's more regulated.
Yeah.
So it's maybe for that reason I'm not seeing as much. Before I used to see a lot more, probably marijuana with K2 and all these synthetic marijuanas and things like that, right? So
it become a zombie.
It was much more
Remember
bath
all those
bath
zombies
salts and
whatever,
everything.
yeah.
So I think maybe legalizing it was part of that was the reason as well, right? I'm sure it's also a big money kind of benefit as well, right?
Well, I mean, look, to me, just looking at it just objectively, right? Look, we prescribe opiates.
And really, that's the treatment for it, right? A lot of times we put them in a quiet room, you kind of dark room, decrease the stimulation, and just kind of let them sleep it off, right? But yeah, there's benefits to it as far as medically, right? I mean, if you use it recreationally, I think that opens you up for a different.
Sure. No, I'm saying too. Look, even in our faith, too, I would say look, there's a reason why there's a prohibition on these kind of things. But I think that's when you've used it improperly, right? Like, look, all medication, you can OD on it, underdose it, overdose. It's all about dosing, right? So, look, you have a pain issue, right? Let's say you have bad knee arthritis, okay, or whatever it is. The shots aren't working, this isn't working, you just need a little Percocet or whatever to get by, whatever. You take the Percocet, it gets rid of the pain. You're not high, you're not whatever. I wouldn't say that's haram, right? So now I was like reading some like things from some new mufti. There's like new fiqh. It's just so controversial. Nobody wants to say it, but we'll say it because we're unplugged here. But there's a lot of new fiqh on like even like marijuana. If it's done under a professional and it's done the right way, it's considered permissible for whatever it is.
Yeah, I mean, I've had patients that suffer from, let's say, anxiety disorder, and they're on like medications like benzos, right?
Would you rather them on a little THC or a benzo?
That's what
I would tell you, right? It's a lot safer to put them on THC.
And we have patients in common as well, right? That are have pain, chronic pain, and they're on opiates. And I've started them on medical marijuana, and from my experience, I've seen patients be able to come off on some of their other medications, and then the discussion really comes to long-term use and benefits and things like that. And in certain cases, like you said, opiates and benzos have
I've seen people get off opiates and benzos. I mean, I've seen so many harmful effects from opiates and benzos. I've seen people who've gotten on medicinal marijuana, gotten off, or really, really cut their dose in more than half. On the other stuff. Like, I mean, I was like, this is a big win, actually. I don't see this as a problem. Okay, my next question to you is, the next thing, which I've read about, and I've seen it with some people, I'm sure it's like, but these patients figure out where to get anything. Psilocybin, microdosing psilocybin, which is shrooms, for whoever doesn't want to know. So it's the active ingredient in mushrooms. So there's a lot of articles, there's a lot of things, there's a lot of things where it shows microdosing, again, under a professional, whatever it is, it's been shown to be very beneficial for like depression and some other mental, I forget what, anxiety too, and something else. I remember it was like 2-3 other things. But depression and anxiety were like number 1 and 2. It really like works, like it really helps the people. I don't know whether it's from rewiring the brain or increasing certain level, whatever it is. But there really needs to be a discussion about psilocybin in the medical community too, in microdosing. I mean, obviously you don't want them hallucinating by taking shrooms and whatever, but just at a microdosing level, I don't.
Yeah, it's, I read an article too as well, right? It was really interesting that it's really kind of made a comeback, right? I mean, this has been around, and there was studies from years ago, right? Even as early as 70s and 80s, and now it's really becoming popular again in different studies and different uses of it, right? And one area, like you said, was depression, anxiety, and even in PTSD, right? It's really shown a lot of. And really, it's not by itself. It's actually with psychotherapy. So the idea really is, if somebody is microdosing and they begin to experience, like, let's say,
improvement or whatever.
They get to either at that time experience some of their symptoms, or have a flashback or something. They're able to then kind of process it and reprogram it in a way, right? I mean, there's a lot of studies on different strategies with that, right? I mean, there's with psychotherapy, there's even like EMDR. I don't know if you're familiar with that. It's like this eye movement, rapid desensitization. And,
no, I don't know this.
And it's similar in that, with somebody who suffers from, like, let's say PTSD or some triggers that affect their symptoms, right? It's really a way of reprogramming it, right? Like your response, not reprogramming the cause of it, is the reprogramming your response to it, right? So there's a lot of studies that are focused on kind of similarly with these psilocybins and hallucinogens.
So are you for them or against them? That's the question.
I don't have much experience with it, but I've definitely, it's still very new. I think we need to get familiar. You're right. Like, even in the community, it's going to be something. Into. I know it's available already, in I believe in Canada and other countries as well. But it's
it'll make its way.
It's going to make its way. So it's something that it requires more research and studies.
Okay, another one. This one I wanted to pick your brain on too. So I had gone to Peru with the family. I wanted you to come on a trip. You didn't come, but it's fine. Whatever. So in Peru, ayahuasca or whatever, right? So the shaman of Peru, like on the mountain, you're supposed to like ingest this stuff or smoke it or whatever the hell it is. And it's supposed to, like, everyone who has this stuff, they come back, they have like a new purpose in life. And they're like, there's like so many stories about all these people who like do it. You have to like prep for it. You can't eat any meat or dairy for like a week before. There's like a whole big thing to it. Like, they tried to get us to do it, but I was like, you're just going to barf your brains out and shit your brains out. Like, I didn't really want to do that. So I was like, no, thank you. Especially since I ate meat literally that morning. So I was like, yeah, it's not happening or whatever. So what's your take on like ayahuasca or like...
yeah, I mean, it's in the same class, right? As far as the psilocybins and all the hallucinogens, and really needs to be in a controlled environment, right? I mean, the famous is Aaron Rodgers and his darkness retreats, right? I mean, for anybody that's a Jets fan. So I don't know in that way, did it help him or not? Because I don't know. The Jets aren't really doing too well right now. Yeah. So I don't know how, he came out of that dark retreat saying he wants to play again, right?
All right.
Anyway, so, it is something that actually has become... people have become more interested because celebrities and athletes and everyone's are also using it to either clear their mind and do these retreats and things like that as well. But it's like you mentioned, it has to be in a very controlled setting, because if you don't have that, it can be really dangerous.
So we had a patient, he's a pilot, and he had some trauma, like he lost his son to drug addiction. It was very sad. He was only like 18 or 19 or something like that. It was or 20, whatever. He was young man. He died. He was like divorced. He had no direction in life. And the guy was only maybe like 50 years old or something like that. So he goes to Peru. He does this ayahuasca. He comes back. He has like a whole new... I saw it with my own eyes. I was like, he had like this whole new purpose. He's like got remarried. He's like started all over. He was like a completely different person, like from 1 month ago.
So that probably shows the reason why we need to,
You know what I'm saying? Like I was like,
things,
wow.
right?
I've never.
Yeah.
I thought this guy was like almost on like suicide watch.
Yeah.
You know, from suicide watch to like one of the happiest people on the planet.
Yeah,
like
that's
I was
amazing.
like, whoa.
That's
I had another one of my reps. You know, I don't want to say his name, whatever it is, but like, he was he's homosexual. He's gay, and he comes from a society where you can't say that, or you know, that's like very taboo, this and that, whatever. And you know, he and his father both did the ayahuasca, and he said it was such a great experience. I was able to come out. My dad accepted me, this and that. He's like, you know, we also got like a great relationship together now. Like it really changed both of our lives, and blah blah blah. And I was like, damn, this thing is nuts. You know, like
it is becoming more popular.
Right?
I mean, it is something that, you know, we need to be aware of.
Yeah, I heard they do these retreats. Like people don't know because technically it's illegal. So, but people do these retreats like in upstate New York or like in like some remote areas. They go to like a cabin. They have like some shaman guy who knows what he's doing, and they like do this. They like stay there for a few days. They like experience whatever. I don't know, you know, whatever. And they come back and they say it was just so amazing, and now they have purpose in life, and now I'm redirected, and I'm, you know, gonna conquer the world, and I'm gonna now build schools and hospitals. I mean, like it's wild because I seen it with like 3 people. And I was like, they're 3 for 3. I was like, my God.
It is. You know, I actually know, you know, it's not a patient, but a friends, and similarly as well. They were going, you know, on like a business venture, and they said, you know what, we're gonna go and use. I want to say it was also ayahuasca, and they said, you know what, but we're gonna actually have like a plan, and they like wrote things down. They went in there, and then, you know, so I don't know how effective it was for them, but they had like, you know, there's different. I guess people find different ways to use it, right?
Yeah.
But you know, I think if someone really, you know, is struggling with something and they haven't really found a way to cure it or treat it, you know, it speaks on what they will go out and try, right? I mean, and to look for a treatment, look for a cure, you know.
So yeah, right. I wanted to just kind of come back to this a little bit because we just kind of touched on it, but I know people are interested in this. How do you tell the difference? How do you differentiate between like jinn, demon possession, the devil possessed you, whatever, and like, you know, psychosis or like, you know, severe mental illness or whatever? Like there has to be some overlap.
Yeah.
Right.
I think that's the big question, right? That we get all the time, and you know, it's in all different cultures where they usually will try to relate it to maybe some kind of possession or evil eye, right? And I think the reason why it's so challenging is really that some of the symptoms overlap, right? I mean, some of the symptoms of mental illness and even possession. And again, we believe in possessions and all this as well, right? Because, you know, it's a creation of Allah subhanahu wa ta'ala. And you know, some of the symptoms that overlap is, you know, some of the ones that are in psychosis or even depression as well is, you know, they start to have poor self-care. Like their hygiene goes down, right? They're not showering or bathing anymore, or they're starting to isolate themselves, right? They don't want to be around people, and you know, they're just started to like change from their baseline, right? Like let's say they're functioning well, but now all of a sudden they're starting to now not be able to do that as well, right? Now, some of the differences that you know, from talking to different even specialists, you know, that treat possessions or have treated in the past, right? Is really that, you know, there's a few major different parts of it, right? One is, you know, sometimes the person who is possessed might be starting to speak different languages or different.
Like he's an American kid and he started speaking Russian or Chinese or something the next day.
Yeah, that's been common as well, right? They might just speak something
nowhere.
that they've never
been exposed to.
They've never been to that world. They've never even been spoken that.
Gotcha.
Or they're like different dialects or even a different voice, right? They might have a different voice and change it as well, right? So that's one that I've heard has been a common kind of symptom as well. Another one is sometimes they get some supernatural kind of powers, right?
Like what?
Like they might get superhuman strength, or they might get some other ability, right? Where they're able to you know, throw things. And you know, interesting. I had you know, a close friend that you know, had a family member that went through something like that, where their younger brother was unfortunately possessed, and they did seek out psychiatric treatment as well, and then some of the symptoms they had was really there, and he told me that in one of his episodes he actually grabbed him and threw him across the room.
The little brother?
The younger brother threw the older brother, and the father was there, and his other brother was there, and I've since met with the family. This is been confirmed by them, right?
Mm-hmm.
That this has happened, right? So that's another one that sometimes you might see with possessions, right? Another one as well is sometimes if because the jinn and whoever the way they respond to someone reciting Quran or prayers or even the azan, right? They usually have a very strong response to it. Like sometimes they might run if the Quran is recited or the azan, or sometimes they might faint or even seize. They might even have a seizure, right?
Yeah, I saw it on YouTube one time. I didn't know it's YouTube. They were like reciting on this person who was supposedly possessed, and they just started shaking like violently, like whatever. And I was like, oh God. I mean, it looked pretty scary. I'm not gonna lie. I was like, either that's some really good acting or that could be a real thing.
Yeah. So those kind of things don't happen in mental illness, right? If somebody who has schizophrenia, or has some sort of psychosis going on, right?
You can read whatever you want. You can read the Bible, you can read Quran, you can read Torah, you can read whatever.
If anything, they might become hyper-religious. Actually, they might start to, look towards their spiritual or religious kind of belief to help them through that, right? Mm-hmm. So a lot of times they might even have the opposite of it, right? So, but yeah, it's very important to kind of differentiate between the two, because you want to be able to do that. Now, given that, right, or stating that, right, it is still important to treat both ways, right? Like I usually say, like when someone comes in and even if they have mental illness or anything, it doesn't mean that you don't, I guess whatever your faith or your belief system has you doing, you should still. Do that,
like we said earlier, it's very rare. You know what I'm saying? It's not, that isn't the default. Okay, the default should be mental illness.
Yeah, it's not as high on our differentials.
Yeah. It's very like down there.
It's a little bit lower.
But I understand, like once 1 out of 100 or whatever it could be. That's pretty crazy. That's there's this like supernatural element to this or whatever. It's pretty insane. All right, so I wanted the viewers too to kind of because a lot of us, we have children, young children growing up in America, growing up, in the West, whatever. And you yourself have 3 beautiful children, mashallah and tabarakallah. And what's some advice that you could like kind of impart to the viewers? Do this, to really kind of avoid, give them like a nice, spiritual, happy life, whatever it is, like give us some like good like tips, to try to keep them away from like mental illness, or like, is there a way to even prevent it,
Yeah, I think the key you said there, right, it was right there, prevent it, right? I mean, a lot of even in medicine and even in psychiatry, right? A lot of our treatments are really geared towards preventing episodes, right? Even patients when they get hospitalized, right? And some of our medications take weeks to work, right? But they get better right away, right? I'll say it. We'll go on.
Okay.
We're on already?
No.
From the beginning?
No, just basically, we're gonna take off from my question. Like, we'll edit out the last few minutes. I'll just start from like, what's some parting advice you can give about raising our children and this and that, right?
And the preventative part too.
Yeah. So for our viewers, a lot of us have children growing up in the West, and we have our kids growing up in United States, Canada, Western countries, and how our societies are and everything. How do we ensure that our children have like a good life? Give us some tips, from you, on like child care and like child development, so that, can they avoid mental illness, or like, can we prevent it? Is there a way to even prevent it? I don't know,
Yeah, no, I think the key is right there, what you said, right? I mean, prevent it, right? I mean, a lot of our treatments and a lot of our, I guess, kind of advice and all this is really geared towards preventing, right? As far as episodes. And
prevention better than cure.
it's really important. A lot of the things that we discussed already, right, is to have a very important, support system, have an important belief and faith system as well, right? You know, one interesting, I guess, kind of phenomenon, if you want to call it, is that I kind of observe all the time is, you know, when we have patients admitted in the hospital, right? We were discussing earlier, and sometimes they can be there for days. You know, they get better pretty quickly, right? Yet a lot of our medications, they don't work as quick.
Right, you got to build a level.
Some of our medications,
It takes weeks.
Yeah. You know, commonly antidepressants take 6 to 8 weeks to really become fully,
lithium, bipolar lithium. I remember you had to build a level,
weeks, right? Yeah. Yet they get better when they're hospitalized within days or even a couple of days, right? So that really shows us likely that they probably need a lot more structure in their system. Routine. They need to make sure they're carrying, you know, they're getting the proper sleep, eating, exercise, other things, even the support system, right? A lot of times we're doing a lot of, you know, family meetings and other meetings as well with the patients. You know, a lot of team approach to just make sure that when they're discharged back into the community, that they have a good, strong, you know, support system and structure in place. So I, you know, if I was to really say, you know, if the child has a healthy, you know, family system, belief system, structure in place, you know, really that's probably the best preventative method that we can have.
You know, we've touched on this in other podcasts or whatever. It's like, I think you're touching on it too again, and it's probably true. I didn't really believe it at first, but now I'm a real believer. It takes a village to raise a child. It really does. It really does. It takes a village to raise a child. Yeah. Well, I think we've covered a lot of topics today. I think it was very interesting, you know, and I'm really happy that we did it in the holy city of Medina Munawwara and in Saudi Arabia. And, you know, I can't wait to have you back on our podcast for episode 2 for you. But, you know, thank you so much. You know, you are actually a really big guide and a big support system for me in my life, to be very honest. So, you know, it's just very nice. And I think what you said today could really help out a lot of people who are watching. So I thank you for that. Jazakallah khair. And we'll get you next time. Stay blessed. Stay great.